Hello, hope you are keeping safe. The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome coronavirus 2. It was first identified in December 2019 in Wuhan, China. The World Health Organization declared the outbreak a public health emergency of international concern in January 2020 and a pandemic in March 2020. As of February 2021, more than 109 million cases have been confirmed, with more than 2.43 million deaths attributed to COVID-19. Symptoms of COVID-19 are highly variable, ranging from none to life-threatening illness. The virus spreads mainly through the air when people are near each other. It leaves an infected person as they breathe, cough, sneeze, or speak and enters another person via their mouth, nose, or eyes. It may also spread via contaminated surfaces. People remain infectious for up to 2 weeks and can spread the virus even if they do not show symptoms. Recommended preventive measures include social distancing, wearing face masks in public, ventilation and air filtering, hand washing, covering one's mouth when sneezing or coughing, disinfecting surfaces, and monitoring and self-isolation for people exposed or symptomatic. Several vaccines are being developed and distributed. Current treatments focus on addressing symptoms, while work is underway to develop therapeutic drugs that inhibit the virus. Authorities worldwide have responded by implementing travel restrictions, lockdowns, workplace hazard controls, and facility closures. Many places have also worked to increase testing capacity and trace contacts of the infected. The responses to the pandemic have resulted in global social and economic disruption, including the largest global recession since the Great Depression. It has led to the postponement or cancellation of events, widespread supply shortages exacerbated by panic buying, agricultural disruption and food shortages, and decreased emissions of pollutants and greenhouse gases. Many educational institutions and public areas have been partially or fully closed. Symptoms of COVID-19 are variable, ranging from mild symptoms to severe illness. Common symptoms include headache, loss of smell and taste, nasal congestion and rhinorrhea, cough, muscle pain, sore throat, fever, diarrhea, and breathing difficulties. People with the same infection may have different symptoms, and their symptoms may change over time. In people without prior ears, nose, and throat disorders, loss of taste combined with loss of smell is associated with COVID-19. Most people mild to moderate symptoms, while 14% develop severe symptoms, and 5% of patients suffer critical symptoms. At least a third of the people who are infected with the virus do not develop noticeable symptoms at any point in time. These asymptomatic carriers tend not to get tested and can spread the disease. Other infected people will develop symptoms later, called presymptomatic, or have very mild symptoms, and can also spread the virus. As is common with infections, there is a delay between the moment a person first becomes infected and the appearance of the first symptoms. The median delay for COVID-19 is 4 to 5 days. Most symptomatic people experience symptoms within 2 to 7 days after exposure, and a majority experience at least one symptom within 12 days, but up to 5 to 10% could extend this period beyond 14 days. Most people recover from the acute phase of the disease. However, some people continue to experience a range of effects for months after recovery, named long COVID, and damage to organs has been observed. COVID-19 spreads from person to person mainly through the respiratory route after an infected person coughs, sneezes, sings, talks, or breathes. A new infection occurs when virus-containing particles exhaled by an infected person, either respiratory droplets or aerosols, get into the mouth, nose, or eyes of other people who are in close contact with the infected person. During human-to-human transmission, an average 1,000 infectious SARS-CoV-2 virions are thought to initiate a new infection. The closer people interact, and the longer they interact, the more likely they are to transmit COVID-19. Closer distances can involve larger droplets and aerosols, whereas longer distances only involve aerosols. Larger droplets can also turn into aerosols through evaporation. airborne transmission is able to particularly occur indoors, in high-risk locations such as restaurants, choirs, gyms, nightclubs, offices, and religious venues, often when they are crowded or less ventilated. It also occurs in healthcare settings, often when aerosol-generating medical procedures are performed on COVID-19 patients. The number of people generally infected by one infected person varies. As of September 2020, it was estimated that one infected person will, on average, infect between 2 and 3 other people. This is more infectious than influenza, but less so than measles. It often spreads in clusters, where infections can be traced back to an index case or geographical location. There is a major role of superspreading events, where many people are infected by one person. Severe acute respiratory syndrome coronavirus 2 is the virus that causes coronavirus disease 2019, the respiratory illness responsible for the COVID-19 pandemic. It is colloquially known as simply the coronavirus. Epidemiological studies estimate that each infection results in 5.7 new ones when no members of the community are immune and no preventive measures are taken. The virus primarily spreads between people through close contact and via respiratory droplets produced from coughs or sneezes. It mainly enters human cells by binding to the angiotensin-converting enzyme 2. The standard methods of testing for presence of SARS-CoV-2 are nucleic acid tests, which detects the presence of viral RNA fragments. As these tests detect RNA, but not infectious virus, its ability to determine duration of infectivity of patients is limited. The test is typically done on respiratory samples obtained by a nasopharyngeal swab. However, a nasal swab or sputum sample may also be used. Results are generally available within hours. The WHO has published several testing protocols for the disease. Chest CT scans may be helpful to diagnose COVID-19 in individuals with a high clinical suspicion of infection, but are not recommended for routine screening. Bilateral multilobar ground glass opacities with a peripheral, asymmetric, and posterior distribution are common in early infection. Preventive measures to reduce the chances of infection include staying at home, wearing a mask in public, avoiding crowded places, keeping distance from others, ventilating indoor spaces, washing hands with soap and water often and for at least 20 seconds, practicing good respiratory hygiene, and avoiding touching the eyes, nose, or mouth with unwashed hands. Those diagnosed with COVID-19 or who believe they may be infected are advised by the CDC to stay home except to get medical care, call ahead before visiting a healthcare provider, wear a face mask before entering the healthcare provider's office, and when in any room or vehicle with another person, cover coughs and sneezes with a tissue, regularly wash hands with soap and water, and avoid sharing personal household items. As of February 2021, 66 vaccine candidates are in clinical research. In Phase 3 trials, several COVID-19 vaccines demonstrate efficacy as high as 95% in preventing symptomatic COVID-19 infections. As of February 2021, 10 vaccines are authorized by at least one national regulatory authority for public use, 2 RNA vaccines, 3 conventional inactivated vaccines, for viral vector vaccines, and 1 peptide vaccine. Many countries have implemented phased distribution plans that prioritize those at highest risk of complications, such as the elderly, and those at high risk of exposure and transmission, such as healthcare workers. There is no specific, effective treatment or cure for coronavirus. Thus, the cornerstone of management of COVID-19 is supportive care, which includes treatment to relieve symptoms, fluid therapy, oxygen support and prone positioning as needed, and medications or devices to support other affected vital organs. Most cases of COVID-19 are mild. In these, supportive care includes medication such as paracetamol or NSAIDs to relieve symptoms, proper intake of fluids, rest, and nasal breathing. Good personal hygiene and a healthy diet are also recommended. The U.S. Centers for Disease Control and Prevention recommend that those who suspect they are carrying the virus isolate themselves at home and wear a face mask. People with more severe cases may need treatment in hospital. In those with low oxygen levels, use of the glucocorticoid dexamethasone is strongly recommended, as it can reduce the risk of death. non-invasive ventilation, and, ultimately, admission to an intensive care unit for mechanical ventilation may be required to support breathing. Several variants of SARS-CoV-2 have emerged that are spreading globally. Mitigation. Speed and scale are key to mitigation, due to the fat-tailed nature of pandemic risk and the exponential growth of COVID-19 infections. For mitigation to be effective, chains of transmission must be broken as quickly as possible through screening and containment. Healthcare must be available to provide for the needs of those infected, and contingencies must be in place to allow for effective rollout. Goals of mitigation include delaying and reducing peak burden on healthcare and lessening overall cases and health impact. Moreover, progressively greater increases in healthcare capacity, such as by increasing bed count, personnel, and equipment, help to meet increased demand. Strategies in the control of an outbreak are screening, containment, and mitigation. Screening is done with a device such as a thermometer to detect the elevated body temperature associated with fevers caused by the coronavirus. Containment is undertaken in the early stages of the outbreak and aims to trace and isolate those infected as well as introduce other measures to stop the disease from spreading. When it is no longer possible to contain the disease, efforts then move to the mitigation stage. Measures are taken to slow the spread and mitigate its effects on the healthcare system and society. A combination of both containment and mitigation measures may be undertaken at the same time. Suppression requires more extreme measures so as to reverse the pandemic by reducing the basic reproduction number to less than 1. Part of managing an infectious disease outbreak is trying to delay and decrease the epidemic peak, known as flattening the epidemic curve. This decreases the risk of health services being overwhelmed and provides more time for vaccines and treatments to be developed. Non-pharmaceutical interventions that may manage the outbreak include personal preventive measures such as hand hygiene, wearing face masks, and self-quarantine, community measures aimed at physical distancing such as closing schools and canceling mass gathering events, community engagement to encourage acceptance and participation in such interventions, as well as environmental measures such as surface cleaning. More drastic actions aimed at containing the outbreak were taken in China once the severity of the outbreak became apparent, such as quarantining entire cities and imposing strict travel bans. Other countries also adopted a variety of measures aimed at limiting the spread of the virus. South Korea introduced mass screening and localized quarantines and issued alerts on the movements of infected individuals. Singapore provided financial support for those infected who quarantined themselves and imposed large fines for those who failed to do so. Taiwan increased face mask production and penalized the hoarding of medical supplies. Thank you for watching till end. Let us hope for a safer tomorrow.